Introduction to medical terminology. Learning outcomes. Describe the fundamental elements that are used to build medical words. List 3 guidelines for building and spelling medical words. Explain the use of abbreviations when writing and documenting data. Learning outcomes. Analyze, build, spell, and pronounce medical words. Identify and define selected abbreviations. Describe selected medical and surgical specialties, giving the scope of practice and the physician's title. Learning outcomes. Define HIPAA. List and describe the general components of a patient's medical record. List and describe the 4 parts of the SOAP chart node record. 4. Comprehension of fundamental word structure. Medical terminology is the study of terms that are used in the art and science of medicine. Because of advances in scientific computerized technology, many new terms are coined daily. However, most of these terms are composed of word parts that have their origins in ancient Greek or Latin. 5. Fundamentals of word structure. The fundamental elements in medical terminology are the component parts used to build medical words. The abbreviations used for component parts in this text are P for prefix, R for root, CF for combining form, and S for suffix. 6. Prefix. Prefix means to fix before or to fix to the beginning of a word. A prefix can be a syllable or a group of syllables placed at the beginning of a word to alter or modify the meaning of the word or to create a new word. Word root. A root is a word or word element from which other words are formed. It is the foundation of the word and conveys the central meaning of the word. It forms the base to which prefixes and suffixes are attached for word modification. Combining form. A combining form is a word root to which a vowel has been added to link the root to the suffix or to another root. The vowel O is used more often than any other to make combining forms. Suffix means to fasten on, beneath, or under. A suffix can be a syllable or group of syllables united with or placed at the end of a word to alter or modify the meaning of the word or to create a new word. Principles of component parts. As you learn definitions for prefixes, roots, combining forms, and suffixes, you will discover that some component parts have the same meanings as others, which can be traced to differences in the Greek or Latin words from which they originated. Principles of component parts. Most of the terms for the body's organs originated from Latin words, whereas terms describing diseases that affect these organs have their origins in Greek. Identification of medical words. You will learn to distinguish among and select the appropriate component parts for the meaning of the word. Spelling. Medical words of Greek origin are often difficult to spell because many begin with a silent letter or have a silent letter within the word. Correct spelling is extremely important in medical terminology because the addition or omission of a single letter can change the meaning of the word. Spelling. 15. Spelling. 16. Spelling. 17. Spelling. 18. Spelling. 19. Spelling. Follow these guidelines for building and spelling medical words. If the suffix begins with a vowel, drop the combining vowel from the combining form and add the suffix. If the suffix begins with a consonant, keep the combining vowel and add the suffix to the combining form. Keep the combining vowel between 2 or more roots in a term. Formation of plural endings. To change the following singular endings to plural endings, substitute the plural endings as illustrated. A as in borsa. To A as in bracet. Ax as in thorax. To aces as in thoraces or as. In thoraxes. N as in foramen. To ina as in foramina. Is as in crisis. To S as in crises. Formation of plural endings. To change the following singular endings to plural endings, substitute the plural endings as illustrated. Is as in iris. 2 ides as in irides. Is as in ephemeris. 2a as in ephemera. 9 as in appendix. 2 ices as in appendices. Inex as in phalanx. 2 gis as in phalanges. Formation of plural endings. To change the following singular endings to plural endings, substitute the plural endings as illustrated. On as in spermatids oon. 2a as in spermatids oa. As in ovum. 2a as in ova. Us as in nucleus. 2i as in nuclei. Y as in artery. 2i and ads as in arteries. Use of abbreviations. An abbreviation is a process of shortening a word or phrase into appropriate letters. It is used as a form of communication in writing and documenting data. If there is any question about which abbreviation to use, it is best to spell out the word or phrase and not use an abbreviation. Pronunciation. A single accent mark is called a primary accent and is used with the syllable that has the strongest stress. A double accent mark is called a secondary accent and is given to syllables that are stressed less than primary syllables. Pronunciation. Diacritics are marks placed over or under vowels to indicate the long or short sound of the vowel. Macron, dash the long sound of the vowel. Breve, dash the short sound of the vowel. Schwa, dash indicates the uncolored, central vowel sound of most unstressed syllables. Audio pronunciations. Abate. Abnormal. Abscess. Acute. Adhesion. Audio pronunciations. Afferent. Ambulatory. Antidote. Antipyretic. 28. Audio pronunciations. Antiseptic. Antitussive. Apathy. Asepsis. Audio pronunciations. Autoclave. Autonomy. Axillary. Biopsy. Cachexia. 30. Audio pronunciations. Centigrade centimeter centrifuge chemotherapy. Chronic. Audio pronunciations. Diagnosis. Diaphoresis. Disease. Disinfectant. 32. Audio pronunciations. Efferent. Empathy. Epidemic. Etiology. Audio pronunciations. Excision. Febrile. Gram. Heterogeneous. Illness. 34. Audio pronunciations. Incision. Kilogram. Liter. Macroscopic. Malaise. Audio pronunciations. Malformation. Malignant. Maximal. Microgram. 36. Audio pronunciations. Microorganism. Microscope. Milligram. Milliliter. Audio pronunciations. Minimal. Multiform. Necrosis. Neopathy. Oncology. 38. Audio pronunciations. Pallor. Palmer. Paracentesis. Prognosis. Audio pronunciations. Prophylactic pyrogenic radiology rapport syndrome. 40. Audio pronunciations. Thermometer. Topography. Triage. Insert table 1-1. Insert table 1-1. 43. Selected medical and surgical specialties. Table 1.1, continued. Selected medical and surgical specialties. 44. Selected medical and surgical specialties. Table 1.1, continued. Selected medical and surgical specialties. 45. Insert table 1-1. 46. Selected medical and surgical specialties. Table 1.1, continued. Selected medical and surgical specialties. 47. Selected medical and surgical specialties. Table 1.1, continued. Selected medical and surgical specialties. 48. Insert table 1 to 1. 49. Insert table 1 to 2. 50. The medical record. The medical record is a written document of information describing a patient and his or her health care. The record contains the dates, observations, medical or surgical interventions, and treatment outcomes provided during hospitalization or a visit to a doctor's office. 51. The medical record. It includes information that the patient provides concerning his or her symptoms, sex, and medical history, results of examinations, reports of X-rays and laboratory tests, diagnoses, and treatment plans. The physical medical record belongs to the healthcare provider, but the information in it belongs to the patient. 52. The medical record basis for planning care and treatment. Means by which doctors, nurses, and others caring for the patient can communicate. Legal document describing the care the patient received and can be used as evidence in court. Manuscript, p. 33, has 2 additional paragraphs in the medical record section. Should this information be included in the PPT presentation? 53. The medical record. Means by which the patient or insurance company can verify that services billed were actually provided. Manuscript, p. 33, has 2 additional paragraphs in the medical record section. Should this information be included in the PPT presentation? 54. The medical record. Health Insurance Portability and Accountability Act, HIPAA. Set of rules passed in 1996 that must be followed by doctors, hospitals, and other healthcare providers to help ensure that all medical records, medical billing, and patient accounts meet certain consistent standards with regard to documentation, handling, and privacy. 55. The medical record. Health Insurance Portability and Accountability Act, HIPAA, requires that all patients be able to access their own medical records, correct errors or omissions, and be informed about how personal information is shared or used and about privacy procedures. 56. The medical record types of medical records: paper, microfilm, photographs of records in a reduced size, microfiche, sheets of microfilm, electronic. 57. The medical record patient information form. A document that is filled out by the patient on the first visit to the physician's office and then updated as necessary, providing data that relates directly to the patient. 58. The medical record medical history, HX. A document describing past and current history of all medical conditions experienced by the patient. 59. The medical record physical examination, P, consent form. A record that includes a current head-to-toe assessment of the patient's physical condition. Consent form. A signed document by the patient or legal guardian giving permission for treatment. 60. The medical record informed consent form. A signed document by the patient or legal guardian that explains the purpose, risks, and benefits of a procedure and serves as proof that the patient was properly informed before undergoing a procedure. 61. The medical record physician's orders. A record of the prescribed care, medications, tests, and treatments for a given patient. 62. The medical record nurse's notes. A record of a patient's care that includes vital signs, particularly temperature, pulse and respiration, TPR, and blood pressure, BP, and treatments, procedures, and patient's responses to such care. 63. Figure 1.1 Nurse's Notes. 64. The medical record physician's progress notes. Documentation given by the physician regarding the patient's condition, results of the physician's examination, summary of test results, plan of treatment, and updating of data as appropriate. 65. The medical record consultation reports. Documentation given by specialists whom the physician has asked to evaluate the patient. Ancillary/miscellaneous reports. Documentation of procedures or therapies provided during a patient's care, such as physical therapy, respiratory therapy, or chemotherapy. 66. The medical record diagnostic tests/laboratory reports. Documents providing the results of all diagnostic and laboratory tests performed on the patient. 67. The medical record operative report. Documentation from the surgeon detailing the operation, including the preoperative and postoperative diagnosis, specific details of the surgical procedure, how well the patient tolerated the procedure, and any complications that occurred. 68. The medical record anesthesiology report. Documentation from the attending anesthesiologist or anesthetist that includes a detailed account of anesthesia during surgery, which drugs were used, dose and time given, patient response, monitoring of vital signs, how well the patient tolerated the anesthesia, and any complications that occurred. 69. The medical record pathology report. Documentation from the pathologist regarding the findings or results of samples taken from the patient, such as bone marrow, blood, or tissue. 70. The medical record discharge summary, also called clinical resume, clinical summary, or discharge abstract. Outline summary of the patient's hospital care, including date of admission, diagnosis, course of treatment and patient's responses, test results, final diagnosis, follow-up plans, and date of discharge. 71. The medical record. SOAP, subjective, objective, assessment, plan, chart note. Subjective. Symptoms the patient feels and describes to the healthcare professional. Also includes the patient's chief complaint. Objective. Symptoms that can be observed, results of laboratory and diagnostic tests may be included. 72. The medical record. SOAP, subjective, objective, assessment, plan, chart note. Assessment. Interpretation of the subjective and objective findings. Plan. Includes the management and treatment regimen for the patient. 73. Abbreviations. 74. Review quiz. The abbreviation for the Health Insurance Portability and Accountability Act is HIPAA. True. False. 76. The abbreviation for the Health Insurance Portability and Accountability Act is HIPAA. True. False. 77. The process of being stuck together is known as abate, abscess, adhesion, afferent. The process of being stuck together is known as abate, abscess, adhesion, afferent. A word element from which other words are formed is called combining vowel, prefix, suffix, word root. A word element from which other words are formed is called combining vowel, prefix, suffix, word root. Excision means the process of cutting out. The prefix X means to cut. Process. In. Excision means the process of cutting out. The prefix X means to cut. Process. In. The spreading process of cancer from one area of the body to another area is known as abnormal, efferent, Malignant. Neopathy. The spreading process of cancer from one area of the body to another area is known as abnormal. Efferent. Malignant. Neopathy. Which branch of medicine is concerned with diseases of the kidney? Family practice. Internal medicine. Nephrology. Neurology. Which branch of medicine is concerned with diseases of the kidney? Family practice. Internal medicine. Nephrology. Neurology. Abate means to increase. True. False. Abate means to increase. True. False. The term for new disease is neopathy. True. False. The term for new disease is neopathy. True. False. A lack of color is called pallor. True. False. A lack of color is called pallor. True. False. The abbreviation for diagnosis is DX. True. False. The abbreviation for diagnosis is DX. True. False. An endocrinologist specializes in treating diseases of an allergic nature. True. False. An endocrinologist specializes in treating diseases of an allergic nature. True. False. The term prefix means to fix before or to fix to the end of a word. True. False. The term prefix means to fix before or to fix to the end of a word. True. False. Cachexia refers to a localized collection of pus. True. False. Cachexia refers to a localized collection of pus. True. False. Widespread occurrence of an infectious disease is called an epidemic. True. False. Widespread occurrence of an infectious disease is called an epidemic. True. False. The branch of medicine concerned with diseases of the lungs is pulmonary medicine. True. False. The branch of medicine concerned with diseases of the lungs is pulmonary medicine. True. False. A trauma surgeon would be responsible for medical repair of traumatic injuries. True. False. A trauma surgeon would be responsible for medical repair of traumatic injuries. True. False. Scenario. You are currently working in a doctor's office. Most of the people your doctor sees are overweight and are seeking help from your doctor. What type of physician do you work for? Anesthesiologist. Bariatrician. Family practitioner. Gastroenterologist. What type of physician do you work for? Anesthesiologist. Bariatrician. Family practitioner. Gastroenterologist. What is not a primary concern of bariatrics? Controlling obesity. Preventing obesity. Stopping obesity. Treatment of obesity. What is not a primary concern of bariatrics? Controlling obesity. Preventing obesity. Stopping obesity. Treatment of obesity. The word root bar means a bar. Bar-shaped. Treatment. Weight/pressure. The word root bar means a bar. Bar-shaped. Treatment. Weight/pressure. In the word bariatrician, ician is what word part? Combining form. Prefix. Suffix. Word root. In the word bariatrician, ician is what word part? Combining form. Prefix. Suffix. Word root. In the word bariatrics, The word rutiaja means physician. One who weight/pressure. Treatment. In the word bariatrics, the word rutiaja means physician. One who weight/pressure. Treatment. Chapter 1 Scenario. The following information was dictated by a cardiologist. 67 years/O Caucasian female, care of chest pain, shortness of breath, and dizziness. Patient appears apprehensive. Cyanotic around lips and mouth. Noted edematous abdomen. A cardiologist specializes in treating patients with diseases of the stomach and intestines, heart, arteries, veins, and capillaries, blood and blood-forming tissues, kidney and urinary systems. A cardiologist specializes in treating patients with diseases of the stomach and intestines, heart, arteries, veins, and capillaries, blood and blood-forming tissues, kidney and urinary systems.